followers. It's very nice to be back, and I have a great guest tonight. We're really, really lucky to have Dr. Mark Morton here, who's going to be talking to us about something really, really important. We're going to be talking about cruciate disease, which is the leading cause of hindlimb lameness, and it is a leading cause of osteoarthritis, and it is a huge concern. It's a huge welfare concern because it is a very, very common condition. And there are some big decisions to be made by the owner when managing this condition. And Mark is going to be here talking about something that he's up to try and help this decision-making process so that you can do the best for your dogs. First of all, I just want to say a massive thank you to our sponsors. As you probably know by now, Big Barker is our sponsor this year. So 2022 is all about Big Barker. The reason that we've connected with them is because they are the only company producing a dog bed that has put it through a pilot study. So this bed has actually been used by the University of Pennsylvania, where they've looked at it in terms of mobility, pain, stiffness, etc. And in initial studies, it showed to be very, very positive. So we're really happy to be working with a company that's got some evidence behind their marketing. So thanks, Big Barker. It's great. Back to Mark. Mark, tell us a little bit about yourself.
Thanks, Hannah. Thanks for everyone.
Oh, you've stalled. Why have you stalled?
Be guests, so I'm glad to be here. I am an orthopaedic surgeon. I'm an RCVS specialist in small animal orthopaedics. I work up at Chester Gates Vet Specialists near Chester. I've been doing, I worked a little bit in general practice when I first graduated, but really been doing sole orthopaedic surgery since then. So cruciates make up a massive part of my workload, and hence getting involved or sort of developing this project from the start, really.
Cool. So let's dive straight into the nitty gritty. What inspired you to get to create this whole concept? What was it that was playing at the back of your head late at night and going, something needs to be done?
Well, we think we know what we should do with cruciates in dogs, but we don't. So there's, as you said to start this session, it is the leading cause of lameness in dogs. Fitting in with CAM, it inevitably leads to arthritis. There's a prevalence of about 0.5% when you look at the studies that have been done through Vet Compass and things like that. So it's a big condition, but there's lots of other things that, when you look at the prevalence of orthopedic disease, stem from cruciates. So, things in those studies like lameness, arthritis, etc., probably a lot of those have cruciates in the background. So it is a big problem. And there's lots and lots of different procedures being performed over the years. We think we currently know what makes a difference, or gives the best outcomes, if that makes sense. But the evidence isn't great. There's been hundreds of studies done on cruciate surgery, if not thousands of studies done on cruciate surgery. But quite a lot of them are done in really small populations of dogs, seen by one surgeon in one centre in a distant part of the world. And it's how relevant are those results to you? So what the Cruciate Registry aims to do is to get real world data about real populations of dogs, your dogs. So the dogs that are treated by your vet, and for owners to be able to look at the results of different procedures, to make it easy to talk and complications with owners. For a lack of wanting to audit results, it's sometimes tricky to do. It's sometimes difficult to put your hands on the data from your practice management system to be able to know whether you've had a complication. And we don't ask owners enough how their dogs do after surgery. So this aims to make that really easy for owners to interact and feedback with how their dogs are doing.
No, totally. And from a first opinion practitioner's kind of viewpoint, I can see why you want to do this, because we're very good at, well, I hope to think that we're very good at the immediate post-op period, and we're good at getting them in for maybe the x-rays to see how maybe the TPLO osteotomy site is healing, and then they disappear. So actually knowing how they really did long term and how they really did comparative to maybe dogs that are managed conservatively or with a different procedure. And that's what you're trying to do, which is really, really unique. And as you say, a lot of the data out there is small study size. It's quite a lot of variability, and they're not very long. And we're making some quite big, bold statements out of maybe not strong enough baseline evidence. So I'm going to maybe share your slides, let you talk about the registry. Then the plan is that we will come back for a chat and we'll be able to answer people's questions. I might pose my own politically driven questions. But we are available to answer people's questions about their dogs and their experiences. Please share your experiences, guys. Please tell me where you're from. A lot of effort goes into making these lives, a lot of communication to bring these people together. So please tell me where you're from, so that we can say hi. And if you have got stories to tell, or if you've got questions to ask, please do feel that you're allowed to. So I'm going to share your slides, and then when you're ready, shout, and I'll just drop them. Okay, ready? Here we go.
Yeah, go for it. So you can see those now, can you, Hannah?
Yes, I can see them.
Okay, so some of this we might have just covered in that little intro, but we'll skip through it, and I'll tell you the important points. These are really just to sort of illustrate how the registry works and things, and some we might gloss over. Interesting to see we've got a viewer from Liverpool, which you'll be able to see is also my homeland. So hello, Lynn.
I wouldn't be without Lynn. She is a formidable lady. She runs all of Holly's army for me.
Okay, so we talked about cruciate surgery being a really common cause of lameness in dogs, and evidence-wise, we said small studies tell you a little bit about a small population of dogs, but what you can look at or can do is something called a meta-analysis, or a systematic review, where you look at the evidence from loads of different studies and you try and put it all together and see what that tells you. So there's two relatively recent systematic reviews about surgery for cruciates in dogs, and they showed that there is increasing evidence that a TPLO, or a tibial plateau leveling osteotomy, gives the best outcomes. But as important, both of these studies highlights there's a real lack of evidence to evaluate other techniques, and certainly a lack of evidence to compare the two together. Treating cruciates can be controversial. So what's the role of conservative management? Well, certainly I would say 100% we lack evidence into the difference between conservative and surgical management. There are a couple of studies that are quite old now, and compared to how we would do studies these days, they're not as robust, shall we say. And they showed that up to about 15 kilos, dogs did okay with conservative management, but above that, they didn't do so great. That doesn't mean there isn't a role for conservative management if surgery isn't an option for whatever reason. But I think anecdotally, most vets and surgeons you would speak to say the outcomes of surgery are generally better than conservative. There's loads of different techniques. So orthopaedic surgeons were still arguing about how the stifle works, let alone what procedure to perform. There's different levels of skill between different vets. Are you a full-time orthopaedic surgeon? Do you do a surgery every now and again? What equipment do you have available to you? There's certainly economic factors here. Don't get me wrong. If your dog is going to have a TPLO performed by an orthopedic specialist, that can cost a lot of money that your insurance may or may not cover. So there's got to be a range of treatments available that can cover all sort of economic situations. There's discussions around how invasive techniques are, patient factors. So does your dog have a heart problem that means it can't have a surgery? Well, then we've got to talk about conservative management again. And of course, there's orthopedic surgeons who will all have their own technique of choice.
I love tribal. I'm going to use that. That's brilliant.
It's very difficult to get a surgeon to do a different procedure once they've got something that they love. And some of that will be based on evidence, but some of that will certainly be based on anecdote as well. So what we need really is more more data, and that's what we're trying to get with this project. Really, I'm going to skip ahead a couple. So our solution to this is the RCVS Knowledge Canine Cruciate Registry. Now, some of you may be familiar with RCVS Knowledge, probably more so if you're a sort of veterinary professional. But RCVS Knowledge is the charity partner of the Royal College of Veterinary Surgeons, so that's where the RCVS comes from. They're independent to the Royal College, but their mission is to advance the quality of veterinary care. They've had a real focus on quality improvement in the last few years. So looking at what we do and trying to do it better. There's great initiatives going on in the vet world, and I'd certainly encourage you all to have a look at the RCVS Knowledge website. They've got lots going on, not just with this cruciate surgery registry, but it's all about looking at what we do and critically appraising it whilst trying to improve. And we're certainly behind the medical profession, but we're getting there.
But it's a really good resource in that I tapped in a couple of weeks ago, and it's got diverse topics being covered.
There's all kinds on there. Yeah,
it's I did a course at the University of Nottingham looking at evidence base, and challenging how we find the data, process the data, discard stuff that's not strong enough, and then bring that together. And you're like, wow, it's labor intensive. And these RCVS Knowledge summaries are incredible quick glimpses of what do we actually honestly know. And it can be something to do with anal gland disease all the way through to cruciate surgery, can't it? It's quite a broad library.
Yeah, absolutely. So anybody who's interested, look in the comments. Amelia, who's one of the team at RCVS Knowledge, she's posted a link.
Yeah, nice to put the link. Love it. She's on it.
Also, so the knowledge summaries are one thing that they do for sure. So they'll look at a condition, and similar to those systematic reviews we talked about earlier on, they'll try and see what the best thing out there is, or what the evidence is behind a treatment of a particular technique. But they do all kinds of other things as well, and some of that's probably more geared towards vet professionals. But there's a whole QI toolbox on there. So if you want to learn how to do clinical audit, if you want to know about benchmarking, if you want to look at doing a significant event review in your practice, it's all on there. They've got loads of other stuff, so that sort of sit with the Cruciate Registry. So under the sort of vet audit hub, so there's a thing that looks at complications with neutering. The national audit of I'm going to get told off by Amelia because I can't remember the full title, but
she'll step in and tell you.
Yeah, she'll put it on there and put the link on. There's an initiative for antimicrobial use. So there's lots of stuff going on with RCVS Knowledge. So check it out if you're a vet or you're an owner. So we're really grateful for RCVS Knowledge's support, and we're proud that we sit in that vet audit program. They've provided significant funding and help with this initiative. We partnered with Amplitude Clinical Outcomes, who are the sort of global leader in human health registries. This project's endorsed by the British Veterinary Orthopaedic Association. We've got ethical approval from RCVS Ethics Review Panel. Our primary outcome measure, and I'll talk about that in a second, is something called LOAD, the Liverpool Osteoarthritis in Dogs questionnaire, which I'm sure will have featured on these CAM talks before. We also use the Canine Orthopaedic Index as well. There we go. Amelia's put it into the National Audit of Small Animals.
She's on
sorry, it. Amelia. Yeah, sorry. So what is a registry? So this is the Canine Cruciate Registry. And it is a surgical registry, as we said. So a registry aims to improve outcomes via feedback to both hospitals and surgeons by recording information about the health of patients and the care they get sort of over a long period of time. So if you had hip replacement or a knee replacement, you would be automatically enrolled into the National Joint Registry in the UK. It's mandatory. If you had a cruciate surgery, you might go onto the National Ligament Registry. There's something called the British Spine Registry. And in the vet world, we've got our own BVOA Total Hip Registry. But the registries also try and pick up failures with techniques or devices, and they try and look for factors that are associated with both good and poor outcomes, and might say whether you are more likely to get a complication or not. So how does this work? Okay, so the Cruciate Registry is open to any vet and, of course, any owner in the UK, but the veterinary surgeon that you're seeing needs to be registered with the project before you can get involved. It can include any surgical technique. It's all digital. Okay, so it's all web-based. There's significant interest from abroad already. Cruciates are the same the world over. So we've had interest from the States, from Europe, from New Zealand, from Australia. So really the only reason why we can't expand further is well, we will be able to, I'm sure. It's just making sure that data laws are ticked off and stuff around different territories. But this allows us to get data from across the world, which just builds that evidence base.
And that answers the question quickly. I'm just going to butt in. Can you link up with hydrotherapy centres? I know I would be happy to help with research at my centre. So that answers your question, Rachel. It's the vets that need to be like a key pivot point. So maybe the best thing you guys can do is talk to all of your supply vets, people that are driving clients towards you, and really push this in their sector. All right, sorry, butted in.
So no, that's good. Answered the question for me. So this is 100% free of charge to any vet who wants to get involved and any owner. We're all about the outcomes. We're not about the income. So from how we built this and how it's run, we have an advisory group that helped us put all the data set together, the information that we collect. The registry is managed by a steering group. We've got a human outcomes specialist on there. We've got a dog owner. We've got an epidemiologist. We've got some experienced veterinary professionals, veterinary orthopaedic surgeons as well. It's really important to say that this is anonymous. The registry is GDPR compliant, and we need consent from both owners and vets. Both owners and vets can withdraw their consent at any point. So if you decided you didn't want to take part anymore, you can withdraw at any point. You won't get any more emails from us, and so on. So we said right at the start that what we don't do enough of is ask how dogs are doing. And that's really the trickiest bit of this project, because how do you do that? So owner and vet assessment is inherently subjective. So if you ask a vet how a dog's done that they operated on, they'll probably say, oh, it's doing absolutely fantastic. It's amazing, because we all want our patients to do well. Similarly with owners, there's significant biases there. If you've invested time and money in a surgery, you want your dog to do well. So ideally what you do to assess lameness is use objective information. So in orthopaedics, what we do is use a force plate. So we'd walk a dog over a sensor in the ground in a clinic or a special mat, and we'd show how much weight it was putting through that leg. And we do that before an intervention, so before a surgery, and then we do it again afterwards at multiple time points, and we'd hopefully see that the dog's putting more weight through its leg and it's consequently getting better. But that's really not straightforward to do. It takes loads of time, it's really expensive, and it's just not viable to do across a large population of dogs. So you can ask owners how their dogs are doing if you use appropriate methodology, and you can use subjective answers to quantify how their dog is doing in something that's called a clinical metrology instrument or an outcome measure. Now, we use these all the time in people. If you had surgery yourself, in people, they're called patient-reported outcome measures, and there's hundreds of them. Obviously, our patients aren't very good at answering questionnaires, so we call them client-reported outcome measures. And we ask owners questions. There's, as I say, hundreds in people for lots of different conditions, and there's a few we have in the vet world, and that's increasing. So we use LOAD, the Liverpool Osteoarthritis in Dogs questionnaire, that's validated with a force plate. So they have shown that the answers that are given in the questionnaire correspond with how much weight your dog was putting through a leg. So if you have a high score, that would mean your dog's not putting much weight through its leg. So it's not a perfect match, but it's pretty good, and that's been shown in studies that they correlate. Right? So that's how we measure the outcomes, and the outcomes are really owner assessed. How the Cruciate Registry works, right, here we go, whistle stop tour. So as a vet or as an owner, as a vet, you need to be enrolled before you can start putting cases on. As an owner, your vet needs to be enrolled before you can take part. So you go and see your vet, or as a vet, you diagnose a cruciate rupture, you discuss with the owner, and you advise surgery, or it's decided that surgery is the right thing to do. The owner is then enrolled on the online platform. Really easy to do. Got a great website, www.caninecruciateregistry.org. If you're a vet, go and have a look at it. In the vet professionals tab, that's how you register. There's a section there to add a new patient. Really easy. All you need is the owner's email address. If you're an owner, go and have a look at the website. There's a great section in owner information, a great section with owner information sheets on there about all the commonly performed techniques, about the registry project, about meniscal tears, about these outcome measures and how we use them. It's a really good resource that vets are finding really useful to use with clients and talk about it.
Oh, it's really good, and it's so easy to navigate. It's laid out in a very simple way. So fab, proper fab.
So once it's been, your vet has enrolled you and they just need your email address to do that, you get an email giving you more information about the project, and just confirming that you want to join. You click on a link and then you just fill in some information about you and your dog, some information about dog's age, how long they've been laying for, etc. And then you fill out what's called the baseline outcome measure. So you're asked, it's about 30 questions about your dog's lameness. That's all you need to do, done. And then you appear on your vet's portal. And when you take your dog in for surgery, and it's really important that you complete that form before your dog has the surgery, because we want to know what your dog was like before surgery. And there's lots of studies that have shown there is a recall bias. So people struggle to remember what their dog was like at the time you're asking them. So you need to do it at the time. So your surgeon does the surgery and they complete a little surgical request form, what procedure they did. And every time you select a different procedure, it brings you up loads of different options. So you can record as much or as little information about the surgery as you want. And then that triggers all the follow-ups. So for the rest of your dog's life, you will get the same questionnaire about how your dog's doing. 6 weeks, 12 weeks, 6 months, a year after surgery, and then every year after that. Vets can use the portal to do their own clinical audits, to look at their own results in real time. When information goes into the registry, it's all anonymized, so vets can see their own results. They can't see anyone else's results. You can't look up an individual vet's result. So there's some protection there, that it's anonymized. And then we'll report the results in an annual report on the website. And when we've got enough cases, we'll submit some papers for publication as well. Okay.
So I just had to mute myself then because I got my friend's dog staring at me and decided to start chatting. So sorry about that.
That's fine. So that's a brief overview of how it works. Few other things to say. So if you're a veterinary professional here, this needs to be a vet that registers because it's vets who are doing the treatment, but we want the whole practice team to be involved. So when you register as a vet, or later on, you can add what's called a delegate. So that might be a member of your admin team, a veterinary nurse at your practice, who can access your account. They can make sure owners of completed questionnaires when they were supposed to. They can check you've put your surgical request form or your surgical report form on, sorry. So they can really help everybody to get involved. So we'd encourage that, and you can do that when you register, or you can email once you're registered and say, please add this person as a delegate on my account. And that, from back to our human colleagues, is key to getting people involved.
And I think
being involved.
It's just the common thing of start using it, and it becomes easier and easier and easier to use. And it's just, as we spoke about before we went live, is trying to get people to engage and make it a routine, make it a habit, make it just something that they start doing, because the more data you collect, the better this is going to be. But I think sometimes things are quite daunting to. I can remember even when Load came out, and I was like, oh god, this looks quite. It's so simple, it's so easy to use, but you need to start using it.
So I think that's the one of the barriers we've faced is getting vets to sign up so owners can get involved. So I haven't had a single owner I've talked to about this not want to get involved. It helps your dog. But it also helps all dogs who are having cruciate surgery in the future. I cannot phone up every owner whose dog I operate on, as much as I'd love to, every week for the rest of their dog's life and ask how their dog's doing. But what I can do is follow on the registry how their dogs are doing.
Yeah.
So I can really easily see if there's a dog that's an outlier or anything like that. If there's a problem, we can see how scores have changed. We can see if dogs are recovering as we'd expect them to. And if there's a problem, we can see that quite quickly. So by filling it out, you're helping us monitor your dog's progress.
And you're also helping the clinician, because the clinician can go back and look at what they're doing and what their success rate. And I think it's not that, I honestly don't believe that there's, bad vets out there, but I think we're really ridiculously busy. And I think, you'll do the preoperative, you'll do the surgery, do your post-operative, and they might just drift away and you don't have the same level of contact with them. So this is perfect for being able to monitor your case progression. And it might be that you're a really competent surgeon that does TTAs and TPLOs, and with all of this information coming your way from the cases that you're treating, you might find yourself, instead of using anecdote, as you said earlier, start actually having more strength and conviction of choosing one procedure over another. Would you agree?
Yeah, absolutely. I mean, I think when you're presented with evidence that's really easily accessible, you don't have to do a lot once you've enrolled and you're putting the cases on to be able to audit your own information long term. When that evidence is easy to access, we're not talking about a paper performed in a university in Florida. We're talking about the cases that came into your clinic that you operated on. You can see how they did. You can tell owners what your infection rate is. I know what mine is with TPLOs because I audit it every year at the clinic. It's not very easy to do with our system, but we do it. I know what our rate of late meniscal tears is because we audit it. And I can tell owners, look, this is what it says in the papers, but at our clinic here, it's a bit lower than that because we do this, we do that, and we think that helps. And we've looked at it, and the evidence from our clinic shows it helps. But that real world evidence really helps owners make decisions about their own dog that's there in front of you with them. So it's so powerful. And you, with this Amplitude portal, you can report on anything that you want to, any of the information that's in there. You can write your own report and look at it. The vets have a sort of standard dashboard that gives them the information we think that they want, and that'll change over time, I'm sure. But if you're interested in something as a vet, you can go and look at whatever you want.
Yeah, no, I think it's great. And I think this is, I'm just going to introduce two owners that have got completely different experiences. So we've got the lovely Mandy Smith, who explains that her dog had bilateral wedge osteotomies 5 years ago and is now at grade 7 agility and doing incredibly well, and is really pleased. Whereas, sadly, Hills Cully has had a terrible experience, and the surgery didn't go according to plan, and she's been left in a very different situation. And I think just showing all the followers those two completely different situations really begins to drive the importance of this? Because it's surgical choice, surgical suitability, competency for the surgery. So many things drive that outcome, isn't it?
You know, I'm an orthopedic surgeon. I talk about cruciate surgery to an owner probably most days of the week. And when you talk about complications and things that might go wrong, lots of owners, you know, some owners will be like, it worries me so much, I don't want to know. And we still have to tell owners, we still have to go through everything, even if they don't want to hear it. There's some owners who say, I totally understand there's a risk with everything. But when you can quantify that risk, it just helps make those decisions. So being able to talk about your own results honestly with the things that might go wrong, but what the chance of that happening is, it means that it's a very transparent conversation with regard to decision making.
No, I think it's amazing. I really honestly do. A couple of questions. I think Laura is incredible. She's been a CAM follower since day dot, and she's also a physiotherapist. Are you collecting information on things like the dog's weight, body condition score, flooring, if the dog's had physio before surgery, so you know if these influence post-surgical outcomes? Blinding.
Yeah, so all that data's put in by the owner and the vet. So the vet does an initial vet assessment where they put the dog's body weight in and condition score. Really grateful to Royal Canin, actually, who, if you're a vet, you might, and if you're owner, actually, you might have seen the Royal Canin body condition score diagram. So they got pictures of dogs that show what your dog would look like if it was whatever body condition score. But they've done them so they vary from breed.
Yes, they're brilliant.
If you've got a Chihuahua, you're not looking at a picture of an Alsatian to determine what its body condition score is.
No.
So in the registry, when the vet chooses what breed it is, it brings up the most appropriate diagram. So if it's a small breed dog, it'll bring up a picture of a small breed dog and all the different body condition scores. It's really clever the way it does it. So we record that. We record body weight. We don't record flooring. We don't record physio pre-operatively, but we do record physio post-operatively. So at the moment, it's just, did the dog have physio post-surgery, or did you advise physio post-surgery?
I'm going to butt in. We interviewed an amazing lady called Carrie Smith, who's a Canadian physical therapist over in America, in Canada, and she audits herself, and she does a lot of TPLO post-op rehab plans, and her data is suggesting with post-op rehab, her 12-week rehab series, the contralateral leg going 18%, which is way different to the average, which could be up to 50%, isn't it?
Yeah, absolutely. I mean, that figure isn't consistent with what's in the literature at all. You know, something like 50% of Labradors will rupture the other cruciate within 6 to 18 months.
I know, so, and that's what you mean. That's what, like, the importance of this auditing is that I don't know what she's doing. I don't know how robust it is. You know.
Yeah, absolutely. There might be
so many other things, but I just think it's fascinating that she's able to look back through her cases and going, right, so how many of them go on to rupture or have severe complications with their contralateral limb? And that's a very different figure to what's out in the literature. But that's the importance of auditing, isn't it?
Oh, absolutely, absolutely. So we've got, there's a big thing about physio and rehab on the Cruciate Registry website. It was written by a former colleague of mine who's a great vet physio. I think she might have been on here, Di Messon.
She's one of our advisors. Woo-hoo! Hey, she's amazing.
I know Di well from working with her, and she's written all the physio stuff for us, and the plan is to work on a physio section so you can add in what variables there might be with physiotherapy. It will still need to be completed by a vet rather than a physio, but at least we're gathering more information on that side of things. So that's hopefully something we'll develop in the future.
Yeah, and that actually brings some little pokey questions. You talked about how there is very little in the literature that compares conservative with surgical. And I'm saying this because we have a lot of people who can't afford surgery, or their dog isn't suitable for surgery, and a horrendous amount of guilt at feeling like they're letting their best mate down because they can't do gold standard. But when you said that the conservative comparison, did that have rehab? Or were they just put on a non-steroidal and get on with it? Because it would be really interesting to see that comparison as well at some point in the future. You know, a very comprehensive rehab plan with a conservative approach, i.e. non-surgical, compared to surgical, because we don't have that data, do we?
No, we don't. And the sort of biggest studies about conservative management are a long time before veterinary rehab and physio was where it is now. It was, you know, sort of rest, maybe rest, no rest, just not surgery, basically.
Yeah.
Now,
exactly.
one of the reasons why that conservative management, well, there's two main reasons why conservative management isn't involved in this. As I've said a few times, it's a surgical registry, but conservative management is very, very difficult to standardize. So what is it? How much rest? How long is a short walk? Are they having anti-inflammatories? Are they using a brace? Are they having physio at the same time? Are they having hydro? Are they not having hydro? So it was a real challenge to sort of standardize all that. There's also a question around confirmation of diagnosis. So there's lots of dogs that, it's got a cruciate. Well, if you didn't look, was it really a cruciate, if that makes sense? So that was one of the other challenges, really. And the other reason why it's not included is because 100% we need to know the difference between surgical and conservative management. I can tell you what I think. I can tell you what I would do if there was no financial or comorbidity issues for my own dog, surgery versus conservative. However, the way to determine the difference between conservative and surgical management is not a registry. That's not what registries do. So it would be a completely different study type to look at the differences between the two. So you'd have to do a controlled trial where you had similar dogs of a similar age and breed and body weight that had been lame for the same amount of time. Otherwise, it's very challenging without a ridiculous number of dogs to get evidence. So registries don't do that kind of research. That's not what they're designed for. So that's not in ours. And it's the same with all the human registries. There are conservative registries and surgical registries. There isn't any that I'm aware of that sort of look at both.
Try and look at both. No, but it just highlights how difficult it is to collect data for those questions, which is what the RCVS knowledge is about, with those profound questions and trying to assimilate all that data. There was another question that was very leading again, another physical therapist from Canada, Laurie Hughes, and she was looking at human data with regards to conservative approach for ACL versus surgical. And the data was suggesting over the lifespan of the individuals or the athletes, they kind of reached a similar endpoint, was what she was suggesting, that the surgeries enabled them to have a good acute recovery. They got back to function quicker, and they seemed to get back quality of life quicker, return to their sports quicker. But when they looked at function later in life, they started to merge together again. And I found that fascinating, because we don't think that far ahead, do we? Of, what's going to be the dog like in 10 years' time. But I thought that was really interesting. And that's why we need data.
Yeah, I mean, I think there's two things there. One is in people, or compared to people, dogs' cruciates are very different. We very rarely see a traumatic cruciate rupture in dogs. Whatever you think, whatever the sort of history is, like my dog was running on the beach and it just went really suddenly lame. In almost all dogs, that cruciate was abnormal to start with. It degenerated, and that run on the beach is what finished it off. True traumatic ruptures, like dog gets hit by a car or clips a fence at high speed, that they're not that common. So most cruciates are abnormal to start with. Now, that doesn't affect treatment necessarily, what we do. But as you said earlier on, it does affect whether the other side goes, because if it's a degenerative problem, it's quite likely the other one will go as well. So there is a difference between people and dogs. And the other difference is, well, in people, sort of my understanding is that if you're an athlete or a high-functioning sports person, or you're one of those and you're very young, then surgery is the way to go. If you're a professional footballer, you ain't getting back to playing football managing your cruciate rupture conservatively. You need a surgery to stabilise your knee, and then you need to do rehab, and you might be playing within a year. Obviously, I'm an elite athlete, as you can tell. But if I ruptured my cruciate, it's likely it would be managed conservatively, and with appropriate rehab, if I did that, I'd probably do fine. But that's probably what happens, you know, when footballers rupture their cruciate ligaments. They can get back to surgery, but long term, their knees probably end up in the same position.
Yeah, exactly. But can we take this opportunity for you to blow the followers' minds with the different surgeries? Because I think a lot of people they probably get a little bit like rabbit in the headlights when they go to their veterinary practitioner and they have cruciate diagnosed, and suddenly it's a barrage of information. And again, to highlight why this registry is going to be so crucial, just list off some of the surgical techniques.
So we put them into 2 or 3 groups, really. So, and this has changed a lot over the years. So there is a group called extracapsular techniques, where essentially, so that, you know, let's go back a step, because before we talk about the techniques, so not everybody might know what your cruciate does. So exactly the same as our own knee, we call it the stifle in the dog. The cruciate ligament sits between your femur, your thigh bone, and your tibia, your shin bone. And the job of your cruciate is to stop your tibia moving forwards and backwards like that. Okay, well, forwards. Now, it also has some other functions. So it stops extension or limits hyperextension, and it also stops it rotating internally a little bit. But the most important thing is that forwards and backwards motion, what we call the cranial draw or a tibial thrust, depending on how you test it. But that's a general idea. Exactly the same as how it works in your knee. So the first group of surgeries, these extracapsular techniques, basically try and put an internal splint in, if you will. So something that goes around the knee, underneath the skin, so you can't see it, but it ties the 2 bones together, so the tibia can't move forwards anymore, and it allows the body to form scar tissue around the joint. The sutures hold their strength for 8-10 weeks maximum. After that, you're relying on that scar tissue that's formed. Okay, there's loads of different ways to do that. Really sort of simple techniques to sort of flashy, your suture attached to screws, but essentially they all have the same idea. The second big group of surgeries is something called the osteotomies. And an osteotomy is a word we just use to describe a cut that you make in a bone. Okay, so there's lots of different ones, but the 2 main ones, and there's variations, are something called a TTA, which is a tibial tuberosity advancement. So tibia is your shin bone. The tuberosity is that little bit at the front of your tibia. So you go down from your kneecap, then you've got your patellar ligament, and then your tibial tuberosity is the bit below there. And advancing it is just moving it forwards. And to do that, you put a little metal spacer in, or a plate, or a wedge of metal foam material that allows bone to grow in over time. And what that's aiming to do is change the mechanics of the knee joint by altering the angle of the patellar ligament, but in basic chat. Okay, and there's that whole group. And the second group is something called TPLO, or tibial plateau leveling osteotomy. Your tibia is your shin bone. The plateau is the little flat bit, sort of, if I do it like that's the best way to do it. If I do it like that, it's the little flat bit at the top of your tibia that the femur sits on, and it slopes backwards or downhill. And your cruciate ligament normally ties the 2 bones together. But when your cruciate's ruptured, what happens is your femur slides backwards or down that slope, and it pushes the tibia forwards like that. Okay, so it's a bit like a car being parked on a hill without its handbrake on. There's only one thing going to happen: when that cruciate's ruptured, the car rolls down the hill, the femur slides backwards, and it pushes the tibia forwards.
Yeah.
What we do with that type of surgery is we don't put the handbrake on. So the first group, the extracapsulars, you're sort of putting the handbrake back on the car. You're trying to keep it on the hill. What we're doing with the TPLO is getting rid of the hill. So you're parking your car in a nice flat car park. So what we do is we make a circular cut in the top of the tibia. We rotate that plateau around till it's flat. And then we don't need a cruciate ligament anymore. The femur doesn't move forwards and backwards. It sits there quite happily when the dog's walking. So in an active sense, when it's bearing weight, there's no movement.
Who came up with that concept? Who went wild card when everybody was doing lateral stabilizations? Just went, nah. Did everybody kind of go, what is this man doing?
There was a surgeon in the States called Barclay Slocum who came up with the idea. So in the early 90s, I think that was first published. And originally it was sort of a patented technique, so you could only buy the implants if you'd been on his course. So he tried to regulate who was doing it so everybody was appropriately trained. And it lacked a lot of evidence for many years. And it's only sort of recently we've got more and more evidence. And there's been a lot of changes in the implants we use with TPLO. So better plates that lock the screws in, that have really changed the outcomes and made the complications few and far between, if you know what you're doing.
Yeah.
There's a few other. Sorry, go on.
I just love it when people take a complete tangent direction. You know, that's a wild move.
And there's a few different ways to do that. So you don't have to make a curved cut. You can make a triangular cut. You can make an upside down curved cut. That's called a CBLO. The triangular one's called a cranial closing wedge. So that's probably the major ones that people do now. There's also.
But would you say that when there's so many different techniques, like this is the most simplistic and facetious comment, if there's always people trying to create new techniques, it means that nothing works in every situation every time. So if you found the holy grail that was always 100% effective in every breed, in every shape, then we would look for another one because it's perfect. Is that fair to say, or would you say that there's
It's fair to say we don't know the answer to that question as a profession. However, I can tell you that I do a few lateral sutures in cats and the odd one in a really small dog. Every other dog I'd see, I would advise a TPLO because I do lots of them. I know the outcomes are good with them. That's not to say any other technique is better or worse, but in my hands,
yes,
I think I get pretty good results no matter what the size of dog is. And that's changed as well because implants have become smaller. And we record all that on the registry. So we would know if there was more complications with a small plate in a TPLO compared to a big plate, or locking screws versus non-locking screws. Yeah. But it's exactly the same with every other technique. So we're recording the variations in implants or slight variations in techniques.
So that leads me on to a very simple question. How long does it take for an owner to fill in the form, and how long does it take for a vet to fill in the form? You know, let's manage people's expectations that are now feeling enthused that they're going to become part of this project.
So if you're an owner, it'll take you 5 to 10 minutes, I would say, to do that initial baseline, because there's a few little bits more information about your dog's breed, etc., and how long it's been laying for. After that, definitely less than 5 minutes when you get a follow-up questionnaire, even a couple of minutes. By the time you've done it a few times, you'll know what the questions are, you'll know how it works, and you just press go.
Yeah.
As a vet, so one of the biggest barriers or perceived barriers is time. People say, well, I haven't got time in a consultation to talk to an owner about this. Well, totally get that, because I'm really lucky. So I have 45 minutes for a consultation with my owners. most vets in general practice might have 10-15 minutes.
Yes.
So I've got loads of time to go through everything in detail and talk to them about the registry. But honestly, that addition of the additional chat about the registry, couple of minutes, if that, just to say, look, this is what it is, this is why we're involved, this is what the benefits are. Be really grateful if you can get involved. All I need is your email address. If you don't want to take part, you can withdraw it later. That's fine. And everyone's like, oh, absolutely, sign me up. Putting the surgical report form on, again, really, really easy, because if you're like me and you can only do one surgical technique, you can just set up a default. So now it knows that I do TPLOs. It knows that we only have one type of implant in our clinic. It knows what manufacturer, who makes the TPLO saw blades we use, because we only have one type, and it's all set up. So I just go, and there's hardly anything that you have to change. So once you get into it, it's really, really straightforward.
Yeah. We just need to get into it, guys, don't we? We need to support this. And
as a vet, you can record as much or as little information as you want. So if you want to record the length of every screw, you can.
Yeah.
I helped develop this thing, and I've never put the length of the screws in that
Good on you for being honest.
So, but it's there if you want to use it in that way.
Yeah. Yeah. I think personally, because I've followed so many people going through this as a first opinion vet, as a friend, as running CAM, it's such a common condition that we really do need to be able to guide owners more effectively. I've got a couple of people that are really sharing their stories, and I don't think, sadly, we can read all of the story. I'm hoping that I will be able to access it in a different manner later. So I'm really sorry, Facebook user from Stroud in Gloucestershire, has not come up with your name either, but hopefully I will be able to access that later. If not, send it to me so that I can actually understand where you're leading with your story, because it sounds like it's a long one. We've got another one down here. This is an interesting one. Elderly lab managed, changing flooring, pain relief physio, 2 whippet poodle mixes approaching. Any preventative advice?
Sorry, could you just read that again?
Oh, sorry.
Oh yeah. No, I mean, I would talk to your own vet about it. It's really difficult to give advice on one case. Make sure there's not more going on there. The biggest thing, sort of, there isn't really anything that prevents cruciate ruptures. If I had the golden sort of ticket to know what stop dogs rupturing their cruciates, I'll be very honest, I wouldn't be sat here talking to Canton. I'd be on a desert island somewhere, living off the proceeds.
Would it be fair to say that she's got breeds there, this whippet poodle mix? Is that fair to say that there might be less prevalence in that?
So we see poodles with cruciate ruptures. We see very few whippets with cruciate ruptures. So there's something there. But it's a real challenge to prevent cruciate ruptures. Now, there is increasing evidence. So if you look at the pathogenesis of cruciates, I mean, it's too deep a topic to get in here tonight, but you only have to look at the cases on the registry. So lots of the dogs are overweight and have a high body condition score. So it'd be a bit of a jump for me to say to you that it's not just the beast dogs that rupture their cruciate ligaments at all, but there's fewer lean dogs on the cruciate registry, and I see fewer really lean dogs than I do overweight dogs. So make of that what you will. So keep your dog nice and lean. Same as I'm sure you tell people managing OA, Hannah.
But also gait observation, like the amount of people that don't watch their dogs walk. Like, I'm in Bude at the moment. We just had a bank holiday, so everybody and their dog have come down for the weekend, and they're chatting away with their mates. And the amount of lame dogs I've seen, and they're just going out for walks as if maybe they're in a treatment plan. I don't know. It's a bold statement. But you do kind of sit there going, do people watch how their dogs are walking? Changes in gait, changes in postures, changes in the way that they sit would be a biggie. Do they sit and they suddenly just leave their knee out like they've got a dirty posture? I call it the dirty sofa posture. But
That is because dogs do that sit. So I did some work with saw some practice with a guy in the States, and he diagnosed all his cruciates on the sort of sit test. And that's because dogs do that because if you look at a normal dog, a dog without a cruciate rupture sit, they sit very square and they flex their hocks, their ankle joints, to about 30 degrees when they sit.
Yeah.
But that loads your cruciate ligament, and because dogs do have an angle to their plateau, as they sit, what happens is that if you've got a cruciate rupture, it hurts because it pushes your tibia forwards.
Yeah.
So what dogs do, if you watch a dog do that, a dog with that posture, watch it sit in slow motion. Well, no, what? Either video it, watch it back in slow motion, or pay attention to what they're doing. But what they do is they go to sit normally, and very subtly they push their foot forwards.
Yeah.
And the hock angle is more like 90 degrees when they're sat. And then what they do is they flop their knee out to the side because it's really uncomfortable to sit with your foot forward at 90 degrees. It's much easier when it's to the side.
But I see so many, like I see this a lot on social media. I see a lot of people turn it into a joke. Oh, he's dirty old man. He sits like that. And you're like, oh, he chooses to sit like that because it's more comfortable. So those sort of things. So going back to the whippet
What
chat.
I would say about that is not 100% diagnostic for cruciate ruptures. So if your dog sits like that, it may be that he's absolutely fine. My mother and father-in-law's dog sits like that, and it hasn't got cruciate rupture. So yeah.
I think it's about change, isn't it? I think being observant of change.
Yeah.
And if you see your dog beginning to move differently, sit differently, the way that they choose to lay down, the way they choose to stand up, get a vet check, you know?
But that's sort of what I'd say, Hannah, is that that's my job, that's your job as well.
Mm.
It's so, all I do all day is look at lame dogs walking up and down. It's really easy to see a lame dog out in the street because it catches my eye.
Mm.
And I often have the same view. I wonder if they've had any treatment for that. Oh, that's this particular breed. I bet I know what's wrong with that dog.
Yep.
But for owners, it is a lot harder.
It is hard.
To pick up those subtle things. So if you're worried about anything, go and chat to your vet, because they'll have seen it before, they'll be experienced in looking at dogs, and they'll be able to tell you whether it's something you should worry about or not.
Yeah. And I think from a very facetious viewpoint, it'd be interesting to compare how many people bring in a dog with a lump that's a lipoma, and we go, it's a lipoma. But the amount of dogs that are brought into us that have got a gait abnormality that's appeared in the last 4 to 6 weeks, where people go, no, it's all right, it's just getting old. And you're like, whoa, the difference there is huge. So a lipoma, guys, is a fatty lump. It's of no danger, but it will really stimulate an owner to get it checked because it's a lump. It instills fear. I must find out what's happened. But there's certain changes that we see as dogs, go into adult, into senior years, that have, it's just part of aging. And I wish people got those things checked too. This is a really good question before we kind of come to an end. Are people going to be able to log into the registry and look at the info you're collecting? So that person's over in the States and it's not relevant to them now, but they went through it in 2019, and it would have been very useful to them to have had access at that point. Will people be able to gain access easily?
So they'll be able to see the results. So as a vet, you can see your own results. You can't see anybody else's. You wouldn't be able to, I want to go and look at Mark Morton's results, I'm going to go and find him. Can't do that. It's anonymous. You can see the results from the registry as a whole. Now, an owner couldn't log into the registry tomorrow and just look at the results, because we need to be really careful that we analyse them properly, and we don't want people to draw the wrong conclusions from them. So what we will do is we have an epidemiologist that works on our steering group, Tim Parkin from Bristol now, and we'll publish a proper report with robust data in it that we know that means something, and that will be open access to anyone who wants to read it. Somebody asked earlier on whether we will publish papers in a format that's easy to read for owners, so sort of non-technical language. Well, absolutely. the peer-reviewed papers that were published, by their nature, have to be written in a certain style.
Yeah.
However, all the data will be available to owners on the website in a way that they
Good.
understand. Not in a, and I don't mean that in a patronising way at all.
No. I tell you who we have to big up for doing that in such an amazing fashion is Vet Compass. Dan O'Neill. Whoop! Really amazing, the processing of the data and making it accessible for the public to understand. Jackie Neal, I am not ignoring you. Again, it's a similar situation where sadly StreamYard will not allow us to see your full story. So what I will do is I'll try and have a look later, and if I can impart any advice, I will do. Shell Radcliffe, thank you so much for joining us. 38 kilo girl has almost certainly done a left cruciate. I'm trying to do conservative management. She's having an x-ray soon. Is currently on ONSI or U-Move. She is a foreign rescue, so I have no history, but she walks very flat on her 4 feet. Orthovets, she has a lot of crepitus in that foot, so possibly an old injury too. I'm looking for other support for her, but only joining this now. Oh, well, yes, lady, there is a lot of info on here. So please go to our YouTube channel, Canine Arthritis Management. Use the search bar. Type in keywords like digital osteoarthritis, toe osteoarthritis. You'll find experts from all over the world who have been giving their time. So do go there. And then if you've got any questions, join Holly's Army, where there are a number of beautiful owners. There's 11,000 owners going through the same sort of things. And it's overseen by a group of trained professionals and semi-professionals who basically make sure that we stick to evidence. There's no kind of marketing, there's no biased kind of content here. And if we help direct you to appropriate sources. Oh, that's quite cool. So many Shih Tzus with funny little legs have so much movement in legs. I don't know what it is, but it's not right. It doesn't seem to bother them. As a groomer, I've sent 3 in the last month to the vet, and the owners didn't even notice it. I think that's a fair. Would you say that's a fair comment? There's the breed morphologies. It can be really hard for people to work out what's normal and what's abnormal in movement.
Yeah, absolutely. And there's a difference between a vast difference between the conformation of different breeds. So, some breed, a Basset or a Daxi with, short legs, turned out feet. You can't compare that dog's conformation to a Greyhound or a Labrador, and of course they'll walk differently. But that's where, if you're worried about your dog, or, as you said, if something's changed, then get your vet to take a look, because that's what they do all day, every day. They look at dogs walking, they know what is normal and what's not normal. And I see lots of dogs where owners are worried about things, or vets have referred them in. And actually, they've always been like that. The dog's not bothered by it. It's sort of normal for them.
Mm-hmm.
And that decision making of, can we make them any better? Well, they're running around the park absolutely happy as Larry. There's no sort of long-term worries. There'll be things that don't need surgery because it's normal for that dog.
Yeah.
But yeah, and again, as a dog groomer, that's a sort of more experienced eye. You're looking at dogs all day, every day. You know the difference between a normal Shih Tzu and a Shih Tzu that's got a really abnormally shaped leg, for example.
And I think just to butt in, it's lovely that the allied professionals, the canine professionals that work alongside us, the groomers, the trainers, the behaviorists, the hydrotherapists, you often have, dare I say, a little bit of a better relationship with owners. They talk to you, they trust you. You're like closer to a peer. They have that in. You'll help me. You get it. Sometimes us vets have this bit of a white coat effect that can put people off approaching us. So high five to the allied professionals that do encourage those owners to go back and get a vet check. So thank you for that. And the last one, statement from Mandy Smith, I think is a really good one to end on, because we keep talking about weight. Been quite overweight before I took her on from my mother-in-law. She'd also been spayed very young. By the time she ruptured her cruciate, she was very lean, but I'm guessing the damage was done beforehand. And as you said earlier, her cruciate disease had started way before I took her on. I think that's a really good kind of example of what you see regularly, isn't it?
Yeah, and it's back to the the difference between cruciate ruptures in people and dogs. Lots of dogs have cruciate ruptures, and they don't just suddenly go lame and hop around. They have this grumbling lameness or just not quite right for long periods of time.
Mm.
One of the things that can make dogs suddenly worse is actually tearing the meniscus, the shock absorber inside the joint as well.
Mm.
Again, something that we look at with the registry. We audit late meniscal tears. We record whether dogs had meniscal tears at the time of surgery. So there can be other things as well as the cruciate that's linked to the cruciate that can make your dog suddenly get worse. But that's a really common presentation. A dog that's been lame for a long period of time. And it's not because the owners couldn't be bothered to do anything about it. It was just, well, it's not that bad.
Mm-hmm.
Let's give it a bit of time. Let's see if it'll get better. And then suddenly it gets worse and the dog's really lame because their cruciate rupture's finally completely given way and the knee's really unstable.
Yeah. And I'm just, I had a thought this weekend, and I just want to say this because it was almost like an epiphany for me. I've been for many years quite firm on why don't people attend to these complications, these clinical appearances earlier? Why is there such apathy? But in the last 2 weeks, I've had so many of my friends go, I've had a bad back for ages, and it just went, oh, actually I've been really struggling with my knees for ages, but they've got suddenly really bad. And we do it with ourselves. So it's no wonder that we're a little bit slow on the uptake with the dogs. We give them a bit of time. It will hopefully pass because we do it with ourselves. So, but hopefully these Facebook Lives will give you more impetus to go and speak to your vets about things. So thank you all for listening, guys. Thank you so much, Mark, for your time. I'll put all the links and all the details so you guys can go and access. Please go back to your vets and tell them about the registry because we're trying to disseminate more messages about its availability and how it's easy to use and the importance of its work. So you as the owners drive this. You as the professionals, please drive this. Speak to your vets that maybe are sending you hydrotherapy cases. And if you're a vet, just sign up. It's really important. So anyway, thank you very much, guys, and we will see you next week. Take care.
Thanks, everybody. Thanks for having me, Hannah.
No worries.